In 1968, under the directorship of Dr. Nicholas DeFrancis, a 4-bed coronary care unit opened, and in 1971, a 16-bed intensive care unit was added. Dr. DeFrancis was an innovative physician. Besides holding a medical degree, he also had a degree in engineering. Because of this, he was able to equip the critical care units with cutting-edge technology, much of which was invented by him in conjunction with our own bioengineering department. St. John's was one of the first hospitals in the metropolitan area to have capabilities to do bedside right heart catheterization. To expedite care of critically ill patients, the intensive care unit had its own mobile dialysis machine and had facilities to do in-unit blood and urine testing, including electrolyte, osmolarity, and blood gas analysis. Dr. DeFrancis also installed a trans-telephonic monitor so that he was able to monitor EKGs and patient data from his office, which was located several miles from the hospital. In 1971, the capabilities of our critical care units were equal only to the most sophisticated and advanced units in the country. Dr. DeFrancis also pioneered the concept of cross-training physicians, nurses, and technologists in critical care. To this end, he held combined conferences for all who worked in the units and videotaped them so that they could be replayed for each nursing shift and each batch of new residents. He fostered a feeling of team spirit and excellence by issuing heart pins to all critical care workers who demonstrated expertise. The pins, which were worn proudly by the staff, were given not only to doctors and nurses but also to clerks, technicians, housekeepers, and other critical care personnel. In 1971, the first outpatient pacemaker clinic on Long Island opened at St. John's. As the hospital began to be recognized as a center of excellence, medical residents began to rotate to the institution. St. John's had now become a teaching hospital. Thus began our long history of residency programs, which continues today and includes programs for the training of internists, family practitioners, surgeons, OB/GYNs, orthopedic surgeons, ophthalmologists, and programs for the training of cardiology, pulmonary, and infectious disease fellows. The 1980s saw an expansion and renovation of St. John's. Every room in the hospital was modernized. A new wing was added, and it was named the Sister Thomas Francis Pavilion. It housed a new emergency room, the radiology suite, the critical care units, the dialysis unit, and an enlarged operating suite. The old part of the building received a new facade, which not only altered its appearance completely, but also provided space for a modern lobby and new patient rooms. Representative Geraldine Ferraro attended the dedication ceremonies for the remodeled building. Sister Thomas Francis retired in 1982 and was succeeded by Jim Foy. And in 1984, the leadership was passed to Sister Helen Falls. Sister Helen oversaw preparations for the celebration of the 100th anniversary of St. John's. At that time, she published a booklet on the history of St. John's Hospital, which was subtitled A Pilgrimage of Healing, 1891 through 1991. The anniversary was observed on April 23, 1991, with a celebration of a Mass of Thanksgiving. In attendance were many members of the Sisters of St. Joseph, representatives from community organizations and businesses, and relatives of Sister Mary David, who founded St. John's in 1891. In 1995, an increase in the population of the neighborhood, combined with a lack of space at St. John's, necessitated the relocation of our outpatient department. The St. John's Family Health Center, located a half-mile from the hospital on Queens Boulevard, was officially opened on October 10th, 1995. Starting in 1998, St. John's began another phase of modernization under the leadership of David Waltz. A magnetic resonance imaging suite was added, a high-tech nuclear cardiology service was established, a completely digital echo lab, a state-of-the-art cardiac catheterization lab, a renovated ultra-modern surgical suite, and an expanded and enhanced pediatric area soon followed. In 2000, in order to further enhance our ability to provide care for patients and to achieve economy of scale, St. John's Queens Hospital and the other Brooklyn and Queens divisions of the Catholic Medical Center merged with St. Vincent's Hospital in Manhattan, and the hospital changed its name again, this time to St. John's Queens Hospital, a division of St. Vincent Catholic Medical Centers. On 9/11/2001, the watched as people from St. John's and other hospitals which make up St. Vincent Catholic Medical Centers faced tragedy with indescribable courage and skill. Ambulances from St. John's rushed to the World Trade Center site and transported the injured from Ground Zero. Police rushed doctors from St. John's into Manhattan to support efforts there. Many patients came to St. John's after having walked from the disaster site across the Queensboro Bridge and down Queens Boulevard. Some came by subway or bus. These were the walking wounded. Many had minor injuries or had suffered from inhaling smoke and choking dust. Others had dust in their eyes. Some were uninjured, but aching from walking so far. First plane struck, James Dobson and Marvin Bethea, St. John's paramedics, crossed the Queensboro Bridge and raced downtown. At Broadway and Fulton, as they began providing on-site triage, they became separated. Then there was a rumble. James looked over his shoulder to see the first building collapsing. He took cover in the ambulance with another EMT and 5 victims. The inside of the ambulance was filled with smoke. They began buddy breathing with one oxygen mask. Ash almost covered the windshield. As a grayish light emerged after the first building collapsed, James got out of the ambulance and saw people covered in white ash. He helped as many as he could. He was afraid his buddy Marvin had died. Meanwhile, Marvin was in a bank a block away when the first building began coming down. Glass broke and debris blew into the bank. There was utter blackness. Eyes and throat burning, he got people out of the bank, flagged down an ambulance, and began placing people inside. Later, Marvin saw an ambulance coming towards him. He noticed that the strobe light on it resembled the one on his ambulance. And in fact, it was. He saw a man get out of the truck, and sure enough, it was James. James was alive. Marvin ran to James and hugged him. They had both survived. Some days later, a picture was found, thumbtacked to a bulletin board at St. John's. It seems that in the middle of all the chaos on 9/11, someone took a picture of their ambulance. Even though the distinctive SVCMC markings are completely obscured by ash and debris, their team name is visible in the picture. On the windshield, a decal that can just be made out reads, "The Mavericks." Although extraordinarily heroic, James and Marvin's spirit of service and dedication to the sick and wounded is shared by all who work at St. John's.
We are the new 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 St. John's.
We're the new St. John's.
We are the new St. John's.
We are the new St. John's.
We are the new St. John's.